Here's a riddle for you. What's called a vitamin but isn't? It's needed by your whole body to function, but we don't get enough of it because of clouds, sunscreen, and windows. And though there's some of it in what we eat, there's almost always never enough of it in our food, which means that millions of us never get enough of it. If you get vitamin D, you're right. Though calling it a vitamin is like calling your smartphone a phone. Actually, it's not even like that. It's like calling your smartphone an adding machine. You see, people say they know what vitamin D is, but really, they don't. I know because it's a conversation I have with my patients literally every day in my medical practice. When I tell my patients I'm going to test their vitamin D levels, they're not just surprised. They're like, whoa, what does that have anything to do with anything, doc? I don't know why, but a very high percentage of patients come in determined to give their doctor advice. They're not just reading a ton of stuff on the internet, they're living it. Expensive supplements, premium organic milk, top-rated sunscreen, the whole deal. Yet, they feel exhausted, depressed, and overweight. And they get sick a lot. It takes weeks for them to get over colds. They're not doing anything wrong. They're just doing what they think is the right thing. So what if the rules that we've been told to follow so carefully are part of the problem? Think of how we live. We work indoors under artificial lights, and we see the world through UV windows, UV-protected windows, and sunglasses, whether we're in our cars or work. And when we do go outside, we cover ourselves in sunscreen. The Cleveland Clinic estimates that 1 billion people worldwide have a vitamin D deficiency. That's within all ethnicities and age groups. That's not just a statistic, that's a global health crisis. And the problem isn't just that people don't know they have low vitamin D, it's far beyond that. People don't understand what vitamin D is or how it helps their body function. We need to stop thinking of vitamin D as a bone-fortifying nutrient that's found in milk, or even as a vitamin, and start recognizing it as a powerful hormone that's needed by every single one of our cells in our body. The story of how vitamin D got misnamed or how it got called a vitamin in the first place is like one of those detective shows where the detective gets led astray, thinks they've solved the mystery, but really they've only solved part of it. The mystery of how vitamin D got its name in the first place begins with a now relatively rare disease called rickets. It's a debilitating bone disease that softens and weakens legs and bones, and it's mostly found in children. Think about Tiny Tim in A Christmas Carol. Charles Dickens never says outright why this young character of his wears leg braces and walks around in crutches, but that's what rickets looks like. And this disease was most prevalent in the 1800s when Dickens lived, during the Industrial Revolution, with children that worked in factories and never saw the light of day. Almost exactly 100 years ago, in the 1920s, doctors discovered that cod liver oil helped cure it. So they classified it as a vitamin, and they called it vitamin D, as it was the fourth vitamin that they'd found. You've all heard of B and C, right? Well, D was next. So far, so good, right? Wrong. You see, back then in the 19th century, No one understood that humans could make vitamin D themselves when exposed to sunlight. That's how D is unlike other vitamins. That's how it's not a vitamin at all. The smog of the industrialized cities had covered the truth, as it did the sun. So people assumed that vitamin D deficiency was a nutrient problem, was a dietary problem. We now know the truth, that vitamin D is more like a hormone than a vitamin. Vitamins are tools our body and cells use for cellular function. Hormones are messengers that coordinate activity throughout our entire body. Hormones communicate organ to organ, cell to cell. Vitamin D travels throughout our entire bloodstream to virtually every tissue, where it binds to receptors and activates thousands of different genes in our body. In fact, vitamin D activates over 2,000 different genes in our body. It preserves not just bone health, but heart health, immune function, cardiac function. It helps regulate our nerves and mood and regulates our metabolism, and much, much more. Despite discovering what we know about vitamin D now, the original name stuck. And that matters because you see, people still misunderstand what vitamin D really is, but also they don't realize the significance of it on their body's overall wellness and health. Virtually every single cell in our body has a vitamin D receptor. Not just some cells, not just bone cells, but virtually every single one of the trillions of cells that makes up who you are. It plays a fundamental role in how our cells function, communicate, and protect themselves. When we don't get enough of it, it's literally turning off our control systems. Think of D for defense. It's our body's military to fight disease. The scale of this problem is staggering. As I said previously, the Cleveland Clinic estimates that 1 billion people worldwide have a vitamin D deficiency, and another 50% of the population have insufficient levels. And the consequence of this deficiency isn't just bone loss. Studies show that optimum levels of vitamin D reduce heart attacks by 50% and significantly reduce respiratory infections, breast cancer, colon cancer, lung cancer, and prostate cancer. During COVID-19, I saw firsthand how vitamin D affected patient outcomes. Patients with low vitamin D had far more challenges and complications from COVID. Just as striking is vitamin D's connection to mental health. Severe deficiency often manifests as depression, anxiety, and other mood disorders. This shouldn't be a surprise to anyone. You see, the science is now clear. Vitamin D is neuroprotective, cardioprotective, and immunoprotective. Here's what's most alarming. We're not testing for this routinely. Most people have no idea their vitamin D number is low until they're already suffering with some medical issue. The path forward is a simple blood test. Finding out your vitamin D number is as basic and critical as knowing your blood pressure or cholesterol. Don't guess that it's okay. Don't assume you know your number or that it's normal. Test and find out. Because once you know your number, the sun becomes your ally. Aim to get 20 to 30 minutes of midday sun with your arms and legs exposed at least 3 to 4 times a week. Along with sun exposure, supplement with vitamin D, because this helps bridge the gap. And look for vitamin D3 with K2, because they work together like a team and help absorb vitamin D in your body. Go outside and have some fun. Get outside and walk, whether you're gardening or playing with your kids or going for a walk. Because combining outdoor activity with exercise magnifies the benefits. And yes, certain foods help. Fatty fish, egg yolks, and mushrooms, all containing vitamin D because they're exposed to UV light, help. But remember, food often is never enough. Medical breakthroughs usually happen in labs. Mine happened in an exam room. Medical breakthroughs usually happen in labs. Mine happened in an exam room with a patient who'd been to a series of doctors before me. Rita's chart was thick of prescriptions, antidepressants, anti-anxiety medications, sleeping aids. None had helped. Rita was a 29-year-old young woman who was a yoga instructor, a young mom of 2, and who couldn't kick depression over the years. She sat in my office, exhausted and depleted, and said something I'll never forget. "I'm not living. I'm just remembering how to breathe." When I tested Rita's labs, her vitamin D didn't come back just low. It came back an 8. We call that a critical value. I remember staring at that number, thinking it had to be a lab error. I had never seen a number that low. This got me digging into the research, and what I found stunned me. Study after study showing low D connecting to depression, linking low vitamin D to reduce serotonin production, and studies supporting that vitamin D receptors in the brain regulated mood and behavior. That low vitamin D increased incidence of depression, anxiety, and other mental disorders. So I prescribed Rita a vitamin D supplement, and she came back in 3 months, not just better, but transformed. "It's like someone turned the lights on," she said. Vitamin D was her medicine. It was then my professional and my personal worlds collided. All I could think about was my sister Padma. She suffered with bipolar disorder and schizophrenia for 10 years before taking her own life. She was only 27 years old. We had tried every medication, every therapy. But had anyone ever tested her vitamin D? That question became my driving force. Over the last 25 years of treating my patients, I made it a point of testing their vitamin D levels and teaching them what it means. When COVID hit and my colleagues criticized my obsession with testing vitamin D levels, I thought of my sister. When patients ask why I insisted on checking their vitamin D levels, I told them her story. And this is what I know now, that we can't go back and help those that we've lost, but we can help change how we help those that are still here. My call to action is very simple, and yes, entirely affordable. Find out your vitamin D number today. It's not just another medical test to maybe add on. No, it's a window into your overall health and well-being. Ask your doctor next time you see them to test your vitamin D levels. And yes, many times you really do have to ask for it specifically. Don't wait until you're suffering from depression or facing a serious illness. Don't leave the stone unturned. Finding out your vitamin D number is just as critical as finding out your blood pressure or cholesterol. One blood test could explain why you're feeling tired, depressed, or sick. And yes, one blood test could save your life or the life of someone you love. Thank you.